Everyone, myself Tejaswini Kokate and my partner name is Pritim Patil, Samruddhi Mohite, Priyanka Dongre and Sakshi Jadhav. Student of Ashokrao Mane, Institute of Pharmaceutical Science and Research, Savi. This video is guided by Mr. A. Andage sir. Subject: Biopharmaceutics and Pharmacokinetics. We are presented by Explain one compartment open model for intravenous injection. One compartment open model, intravenous bolus administration. When a drug that distributes rapidly in the body is given in the form of rapid intravenous injection, it takes about 1 to 3 minutes for complete circulation, and therefore the rate of absorption is neglected in calculation. The model can be depicted as follows. Estimation of pharmacokinetic parameters. For a drug that follows one compartment kinetics and administered as rapid IV injection, the decline in plasma drug concentration is 1 due to elimination of drug from body. The phase being called as elimination phase. Elimination phase can be characterized by 3 parameters. First, elimination rate constant. Second, elimination half-life. Third, clearance. Elimination rate constant, integration of equation is in x is equal to in x naught minus ket, equation first, where x naught is equal to amount of drug at time t is equal to 0 is that the initial amount of drug injected. Equation first can also be written in the exponential form x is equal to x naught in negative minus ket. Equation second. The above equation shows that deposition of a drug that follows one compartment kinetic is mono-exponential. Transforming equation first into common logarithm, log x is equal to log x naught minus ket by 2.303, equation third. Since it is difficult to determine directly the amount of drug in the body, x advantages is taken of the fact that a constant relationship exists between concentration in plasma C and X. Thus, X is equal to VDC, equation 4th, where VD is equal to proportionality constant properly known as the apparent volume of distribution. It is a pharmacokinetic parameter that permits the use of plasma drug concentration in place of amount of drug in the body. The equation therefore becomes log C is equal to log C naught minus ket by 2.303, equation 5th, where C naught is equal to plasma drug concentration immediately after IV injection. Figure first A, Cartesian plot of a drug that follows one compartment kinetics and given by rapid IV injection. And second, semi-logarithmic plot for a rate of elimination in a one compartment model. Thus, C naught Ke can be readily obtained from log C versus T graph. The elimination or removal of the drug from the body is the sum of urinary excretion, metabolism, biliary excretion, pulmonary excretion, and other mechanisms involved therein. Thus, Ke is a additive property of rate constant for each of these processes and better called as overall elimination rate constant. Ke is equal to Ke plus Km plus Kb plus Ki plus dot dot, equation 6. The fraction of drug eliminated by a particular route can be evaluated if the number of rate constant involved and their values known. Fe is equal to Ke by Ke. Fm is equal to Km by K, equation 8. Elimination half-life, also called as biological half-life. It is the oldest and the best known of all pharmacokinetic parameters and was one considered as the most important characteristic of drug. It is defined as the time taken for the amount of drug in the body as well as plasma concentration to decline by 1/2 or 50% its initial value. It is expressed in hours or minutes. Half-life is related to elimination rate constant by the following equation. T half is equal to 0.693 by Ke, equation 9. T half is equal to 0.693 Vd by Cit, Equation 10. Apparent volume of distribution. The two separate and independent pharmacokinetic characteristics of a drug are first apparent volume of distribution and second clearance. Since these parameters are closely related with the physiologic mechanism in the body, they are called as primary parameters. Modification of equation 9.7 defines apparent volume of distribution. Vd is equal to amount of the drug in the body by plasma drug concentration is equal to x by c, equation 11. Vd is a measure of the extent of distribution of drug and is expressed in liter. The best and the simplest way of estimating Vd of a drug is administering it by rapid IV injection. Determining the resulting plasma concentration immediately and using the following equation. Vd is equal to x naught by c naught is equal to IV bolus dose by c naught, equation 12. This equation 12 can only be used for drugs that obey one compartment kinetics. Question 2. Explain mammillary model. This model is the most common compartment model used in pharmacokinetics. It consists of one or more peripheral compartments connected to the central compartment in a manner similar to connection of satellite to a planet. The central compartment comprises plasma and highly perfused tissue such as lungs, liver, kidneys, etc., which rapidly equilibrate with the drug. The drug is directly absorbed into this compartment. Elimination to occurs from this compartment since the chief organs involved in the peripheral compartment or tissues compartment are low vascularity and poor perfusion. Distribution of drug to this compartment is through blood. Movement of the drug between compartments is defined by characteristic first order rate constant denoted by letter K. The subscript indicate the direction of drug movement. Thus, K12 refers to drug movement from compartment 1 to compartment 2 and reverse for K21. Model first represent one compartment open model intravenous administration. Model second represent one compartment open model extravascular administration. Model third represent two compartment open model intravenous administration. Model fourth represent two compartment open model extravascular administration. Model fifth represent three compartment open model intravenous administration. Model 6 represent three compartment open model extravascular administration.